Hi, I'm Ben, and today we'll be going over the muscles of the human body. Shall we? We'll start with the facial and cranial muscles. Seen here is the masseter, which is used in mastication or chewing. It's a vertical muscle that raises and lowers the jaw. The origin is the zygomatic arch and maxillary process of the zygomatic bone. The insertion is the angle and lateral surface of ramus of mandible and the coronoid process, and the action of the muscle is elevation and protrusion of the mandible. Next, you can see the occipital frontalis, which extends from the occipital bone to the frontal bone. Seen here is orbicularis oculi, which is the muscle that surrounds the eye. Here is orbicularis oris, or how I like to remember it is oral, which is the muscle that surrounds the mouth. And we can see above the ear, temporalis. Moving down to the neck, you can see the sternocleidomastoid, which the origin is the manubrium of the sternum, where it gets sterno from, and the clavicle, cleido. The insertion at the mastoid process of the temporal bone, so it's sternocleidomastoid. The action of this muscle is contralateral cervical rotation. Moving down, we have our chest muscles. Seen here is pectoralis major. It's a superficial chest muscle. The origin is the clavicle, sternum, and costal cartilages. The insertion is the greater tubercle of the humerus, and the action is adduction, flexion, and rotation of brachium medially. Deep to pectoralis major is pectoralis minor, which cannot be seen on this model. Here you can see serratus anterior, which is infralateral to pectoralis major. Also, you cannot see on this diagram, but we have our external and internal intercostal muscles. The external intercostals are used for inhalation, and the internal intercostals are used to hold the ribs in place. Moving into the abdomen, you can see here the rectus abdominis muscles. The origin is the crest of the pubis. The insertion is costal cartilage of ribs 5 through 7. And the action is flexion of lumbar spine. You can also see the external oblique muscles, which run oblique to rectus abdominis. And on the left side of this model, you can see the internal obliques, which also run oblique, but they would be deep to the external obliques. Seen on this model, we have our diaphragm, which is the muscle used in respiration, and you can also see transversus abdominis, which is a transverse muscle, and it is the deepest of the core muscles.
Now we'll be talking about the muscles of the arm. Right here is your biceps brachii, which has 2 heads. Your long head is lateral, and your short head is medial, and the short head originates at the coracoid process of the scapula, and your long head originates at the supraglenoid tubercle. They both insert into the radial tuberosity, and the action is to flex the forearm. Deep to the biceps brachii, we have the brachialis muscle, and medial to the brachialis, we have the coracal brachialis. Moving to the forearm, we have the pronator teres, and it's the oblique muscle, and it allows us to pronate our forearm. Medial to the pronator teres, we have a flexor carpi radialis, which if you follow up, it goes to the thumb. And then your flexor digitorum is deep to both your flexor carpi radialis and your palmaris longus, which is medial to your flexor carpi radialis. And then on your pinky side, you have your flexor carpi ulnaris. Moving to the hand, we'll start on the thumb side. On the outside, we have the abductor pollicis brevis, which abducts the thumb. Next to it, we have our flexor pollicis brevis. And next to the flexor pollicis brevis, we have our abductor pollicis. And then in between the metacarpals, we have our lumbricals. And then on the most outside of the pinky, we have our abductor digiti minimi. And next to that, we have our flexor digiti minimi brevis.
Now we'll be describing the muscles of the leg. We'll start with the thigh. Seen here is rectus femoris. It is in the middle anterior portion of the thigh. It originates at the anterior inferior iliac spine. It inserts at the patellar tendon, and the action of this muscle is knee extension. Deep to rectus femoris is vastus intermedius. On the medial side is vastus medialis, and on the lateral side is vastus lateralis. Seen here is sartorius, which is notorious for being the longest muscle in the human body. Deep to sartorius, you can see iliopsoas, and we can see a small portion here of pectineus, and we can also see adductor longus. Medial to adductor longus, we have adductor magnus, and we'll go over the origin of adductor longus is the pubic body right below the pubic crest. It inserts in the linea aspera, and the action is adduction and flexion of the hip. On the very medial side, we can see gracilis, which is a superficial vertical muscle on the thigh. Moving down to the leg, seen here is tibialis anterior, which is simply a medial muscle of the leg, and lateral to tibialis anterior is fibularis longus, seen here. All the muscles we just covered were on the anterior side of the body. Now we're going to transition to the posterior side, shall we? We'll begin with the deltoid muscle. Seen on this model, here this is the deltoid, and on this model we have the deltoid here. It is a round muscle on the shoulder. The origin is the clavicle, acromion, and spine of the scapula. The insertion is the deltoid tuberosity and humerus, and the action of the muscle is to abduct, extend, and flex the brachium. Seen here, we have the trapezius. It is a very large superficial muscle of the back. The origin is the spinous process of the vertebrae. The insertion is the clavicle, acromion process, and spine of the scapula, and the action of the trapezius is to adduct and elevate the scapula. Seen here is levator scapula. It is an oblique neck muscle. Deep to trapezius, we have rhomboid major and rhomboid minor. Rhomboid major is inferior to rhomboid minor. The origin are the spines of T2 through 5. The insertion is the inferior angle of the scapula, and the action is to elevate and adduct the scapula. Next, we will go to supraspinatus. It also cannot be seen on this model, but it is located superior to the spine of the scapula, supraspinatus. The origin of supraspinatus is the supraspinous fossa. The insertion is the greater tubercle of the humerus, and the action is to initiate abduction. Infraspinatus is located on the inferior portion of the spine of the scapula, also cannot be seen on this model, and also that can be seen on this model are teres major and minor. Teres major is inferior to teres minor. You can also see latissimus dorsi, which is the largest superficial back muscle, and then we'll go over the deep back muscles. From lateral to medial, we have iliocostalis, longissimus, and spinalis. An easy way to remember these erector spinae muscles are I love spine. Iliocostalis, longissimus, and spinalis.
So now we'll be talking about the arm muscles. Right here we have the triceps brachii with its 3 heads, these 2, and then the medial head is right here. It originates at the humerus and infraglenoid tubercle of the scapula. It inserts into the olecranon process of the ulna, and its action is to extend the arm and the elbow. Moving to the forearm, starting most medial, we have brachioradialis. Next to it, we have extensor carpi radialis longus, and this small muscle is extensor carpi radialis brevis. Right in the middle, we have the extensor digitorum, and the muscle leading to the pinky is the extensor carpi ulnaris.
Now we'll be talking about the posterior muscles in the thigh and leg. We'll start here with the gluteus maximus. It's just simply the butt muscle. The origin is the gluteal surface of ilium and the sacrum. It inserts at the gluteal tuberosity of the femur and also the iliotibial or IT tract, and the action of gluteus maximus is rotation and extension of the hip joint. Deep to gluteus maximus is gluteus minimus. Moving down the thigh, seen here is tensor fascia latae. It is an upper lateral muscle of the thigh. The origin is the iliac crest. The insertion is the iliotibial tract, and the action is the flexion of the hip, medial rotation, and abduction of the knee. Moving down, seen here is biceps femoris. Here is semitendinosus, and this is semimembranosus. Moving down to the leg, we have our gastrocnemius, which is a large superficial muscle. The origin is the lateral and medial condyles of femur. The insertion is the Achilles tendon, and the action is flexion of the knee. Deep to the gastrocnemius, we have our soleus. Thanks for watching. I hope you learned something.